This is the infantilizing language we're talking about. Sorry that they care about the health of your child. So many risks, including death, come with going past 41 to 42 weeks, so it's not worth waiting past that time. It's true. Death can happen at any time. It's very sensitive, it's very real, it's very raw. It can happen at 30 weeks, it can happen at 40 weeks. The risk does go up as pregnancy goes on. However, the risk is still relatively small. That doesn't mean it happens to nobody. It just means your chance of it happening or the chance of it happening to your baby is relatively small. And so when your baby has over a 99% chance of surviving at 42 weeks, it is not inherently irresponsible for a woman to choose to continue her pregnancy versus end it with induction, because induction also comes with risks to you and your baby, including death. Amniotic fluid embolism is higher in inductions, even though that is still quite rare. If you have a scarred uterus, the chance of you having a uterine rupture is greater during an induction than going into spontaneous labor. There are so many different risk-benefit analysis that each individual woman has to make. And obstetrics and midwifery throwing a blanket stop at 42 weeks does put a damper on women's autonomy. And that does not negate if there's hypertension or other risk factors going on. But practitioners and providers saying they support autonomy and choice when it comes to abortion or choosing to be induced, but then saying that going past a certain gestation is just a hard no and it's irresponsible and it's wrong and you're putting your baby at a risk, is an example of how coercive the culture of obstetrics is towards women. Because again, there are risks to inducing for you and your baby. And ironically, some women don't want to take that risk and feel more comfortable, more confident, and safer continuing to have and wait for a spontaneous labor. So Nancy, you are contributing to the problem, and this type of language has got to stop.